So the landscape is changing quite a bit in oncology. We see that over the last decade, about 50% of private oncology clinics have aligned with hospital systems, largely because of payment policies that have been favorable for hospital systems, like the 340B program, site of service disparity. What we see, though, is in community oncology, because the environment has gotten more difficult, a lot of groups are looking for partners, ways in which they can have economies of scale and efficiencies of scale and power in numbers in trying to move forward in this ever-changing landscape. So you've seen various different management services groups emerge, really with the goal of clinical and sometimes financial integration. They can be sort of heavy, like U.S. Oncology. So I'm a partner in Texas Oncology, and we're part of the U.S. Oncology network. So there are many associated services that we get, one being a low cost of capital that allows us as a practice to grow and develop over time. We also have group purchasing organization, or GPO services, management of our systems, of our IT systems, management services, clinical integration, financial integration, though we're an independent practice. So I would say that that's really a great deal of support. And other groups have emerged as well. So America Oncology Network, which was born out of Florida Cancer Specialists, has emerged as a practice solution for community oncology practices. One Oncology, which is Tennessee Oncology, and Jeff Vaserka's practice in New York, are part of One Oncology, has emerged as a way that practices can aggregate and have efficiencies and economies of scale. And then you have other groups that I think are not as deeply integrated, but intellectually aligned in their goals with practice. And you see that with the NCCA group that Sybil Blau is running, and the QCCA group that Barbara McEnany is running. You know, what you don't want to see happen is every oncologist in America to try to come out with their own value-based models, their own pathways, different ways to do things. You know, you couldn't make an apples-to-apples comparison between us. And so you see many different private practices seeking partnership. And really the goal of that partnership is clinical integration, sometimes financial integration, to be more effective at things like value-based care, to help navigate this complicated landscape before us. I think we'll see those continue to grow.